Hey, Dr. Alan Christianson here with you. So one of my favorite things is testing glucose at home, testing your fasting glucose level first thing in the morning. So fasting glucose tells you your glucose regulation, and the bulk of that is your pancreas and your liver. So when you wake up in the morning, it's not measuring post-meal glucose, postprandial glucose. There's so much thought about how food affects your blood sugar, super important. But the big part about metabolic syndrome, prediabetes, and diabetes is not what your food did to your blood sugar, it's what your liver and your pancreas did to your blood sugar. And that's what fasting glucose tells us. It's how your body's internally regulating it, not what the last meal just did per se. And it's amazing, this is such a powerful predictor of total mortality, disease risk, brain aging, inflammation, kidney failure, you name it, all kinds of big stuff. And you can spend $30 for a set of really good equipment and maybe $1 per slide and check this, I don't know, every few times a month or so and get a good handle on how your body is doing. The other really cool thing is you can see how various interventions affect that. You know, if you're on a trip, you're traveling, your schedules change, you can see how a few nights of disrupted sleep can change your fasting glucose, or a couple of really hard meals, or adding in a new workout, or maybe overtraining. You can very objectively see how your glucose is responding to various things. So without any further ado, I will segue into the tutorial. It's crazy easy, but if you've not been showed how, it's easier when you're showed how. And I'll give you a few pointers as well. Okay, this is the demonstration phase of this. And really straightforward thing, clean your hands really good beforehand, no pun intended. Mine actually are clean, believe it or not. I have been doing a lot of work around the house and on the Jeep this last few days, and they're about as clean as you're going to get, short of any heroic measures. So you're going to get a swab out and clean the site that you're going to use. Now, you'll often see people use the pad of the finger. You know, it sure does work. It's pretty common. There's also a lot of nerve endings there. You'll feel that more than you will most anywhere else. The side of the finger, not right by the nail, but right on the edge to where it's still a little bit soft. Let me grab a pointer here. That'll work for a pointer. So right about there is a great spot. It's still pretty fleshy, but there's not a large number of nerve endings like there are right on the pad. So you can get good blood, but not a whole lot of nerves. And you can select the outside, the inside, and you can use every finger. So if you're doing this often, you can rotate sites really easily. So I'm going to do this index finger right here. I'm going to swab it really good. Now in terms of the meter, I'm going to give you some links. One of my dearest friends was teetering on diabetes. Thankfully now we've been able to reverse that for him. But I'll give you a link of the unit that I just sent him in the mail a while back. The best ones are $20, $30. There's lots of good options. They're pretty simple. There's more that are starting to integrate with the phone, meaning you can plug a piece into your phone and have that read it. You know, it's a nice feature, but so far none of the ones that work well and do that are cost effective. So this is still the best standby to date. Now you're going to use couple of units. You've got the slides, you've got the glucometer, you've got your lancet device, and you've got the lancet. So I guess we've got these four pieces, right? Now, certain slides are compatible with certain glucometers. And honestly, the whole gimmick about the cost of this is the slides. So just be aware of that. If you're really pricing them out, price based upon the slides, not based on the unit. They pretty much give away the unit just so they know you're going to buy the slides afterwards. But make sure they are compatible. In most cases, when they are compatible, you can just put in a slide and the unit will know which slide it is. It will automatically calibrate. There's nothing past that you have to do. So the lancets, these are nice. They make it really easy, especially with these activators. So you'll open this up. I did not have one in there before. So you'll take out the old lancet, take out the piece on it that blocks the needle, and put that right in the spring-loaded device, like so. And you'll then put the cover back on, like there, and make sure it's loaded. Now you can adjust how far this thing penetrates. There's different numbers it'll show on this scale, and really you might as well have it at a higher number because they don't go very far. They don't go in very deep in general. So you'll clean this spot off. You make sure you've got a slide, make sure it's ready. Check the date on these things too. These do expire. These are actually good through the end of this year, so they're current. And then milk your finger a little bit. You get some blood built up in there like I'm doing. And once that's the case, hold the end against there, press the little button, and you got it. These new units don't take a lot of blood. That's great plenty right there. So you'll then take the slide, ideally without handling too much of it, and just put it in. That turns the machine on. If you get it in the right way, there we go. That turns the machine on, so it confirms that it's the C25 slide, that's C25, and it's all ready to go. It's showing this dripping, this blinking dot of blood, drop of blood. We get a countdown, and you got your reading. So I happen to be at 84 right now. It would have been a real bummer if I had a bad number to show you guys. I really don't. I've got pretty good control of blood sugar these days. But it's that simple. And these are so tiny. You can swap out the lancets every single use. I personally think it hurts less if they've been used a couple of times. So I'll use them probably half a dozen times. And with good cleaning and good alcohol use on the site, there's really no risk for infection with these things. They're so tiny. Make sure it's just you yourself using it, obviously. If someone else were to use that, you'd want a clean, fresh lancet. But that's simple. You can log it, record it, and take it all from there. So take great care. Back with you really soon. Bye-bye.